Hello, good afternoon. Hope you have a wonderful day. Today I'm doing a presentation on the personalized medicine intelligent agent system. Have you ever felt, okay, I have a headache, and let me go and get a tablet from the hospital? But when you think about waiting in line for seconds, hours, minutes, you say, oh, I'd rather not go to the hospital. I'll just maybe cruise with my headache. Well, the personalized medicine intelligence system is going to eliminate that process, whereby from the comfort of your home, school, anywhere you're comfortable in, you can maybe search online, okay, I have a headache. Then the system can intelligently interact with you from your data, from your record, from your record for the hospital. You can see, okay, this person from a certain blood type, health record, you should better take this tablet, maybe Panadol or paracetamol if it's a headache, or take this certain tablet due to your health record. This tablet is suitable for you. So that's what this system is all about, is intelligently detecting what is suitable for the user without much mental effort, and reducing the stress of going to the hospital daily or going to the surgery to meet a doctor to prescribe tablets for you. With a little understanding of the topic and the problem statement the project is trying to solve, what does the user researcher does in this project, and what information, what skills can he bring in? Well, as a user researcher, the most important thing is to understand the needs of the project. That is the user needs and the stakeholder needs. The stakeholders in the project can be the university, can be the tutors, can be the public, can even be the government. So you need to understand their needs, and you have to carry that out. You can do that through qualitative and quantitative research. Another thing you need to do, you have to carry out several analysis like SWOT and PERSOL analysis, in order to find out good data that will be used for the implementation of the project, and to find out quality unbiased data. You need to give daily reports on the research you are carrying out to the project managers, so your success and the completion criteria could be met and could be estimated. You also need to give a managerial estimate of when you are going to complete each phase of the project. You need to prioritize your deliverables. You need to understand the business needs, and most importantly, you need to outline the competitors. For example, for a project like this, I did a little research online, and I found out that there are two main competitors. There's Medical Helper and there's MediSafe. They offer almost the same thing, but there are several reasons why they are limited. After carrying out the research online, I found out why a lot of health applications don't work. And number one reason is that the usability is very poor, so users can't really interact with it. The user experience is very poor, and as a user researcher, you have to understand the users, get into their minds, try to understand what their goals are, try to review the research you get from the surveys from them, try to understand and match those goals. Another reason why most health applications don't work and most health systems is that they are not regulated properly, and they don't have enough information from health experts, so which makes this application fail. So as a user researcher, I'll go to experts like doctors, nurses, go to the hospital and try to have an interview with a doctor and find, okay, in so area and so area, for example, what type of disease or what type of illness is it advisable to do self-diagnosis, whereby I don't need to visit a hospital. So information is what the user researcher does. As a user researcher, this is my strategy to make sure the project is as successful as possible. First of all, I want to understand the problem statement. What is the problem this project is trying to solve? Then secondly, I'd like to know our target audience. Who are the users of this project? I'd like to know our competitors out there. Who are the people that we are competing against currently in the market? What are the stakeholders in the project, and what are the user needs and goals? Also, I like to know the potential risks to this project, because every project has its own risks, and these risks we have to see how we could minimize them so they don't threaten the success of the project. I like to prioritize deliverables and make sure that each team member is aware of each completion of the deliverables. I like to make sure that the deliverables are also met on time before the deadline date. I also like to meet experts in the medical field, so I could find out what notion, what they think about the project, and ask some questions that will be used during the implementation stage of the project. I also get a better understanding of the risks we could face in the project, and some needs that users might be interested in. And also, very importantly, I would like to feedback the team with daily reports and also reduce errors and bias in the data analysis from the research. This is a short interview I carried out with a doctor that is studying at the University of Southampton, and I just asked a few questions so I could give the project managers an idea of how I carry out my data analysis and how I carry out my research. So the first question I asked her, what are the types of patients, so you can know for example users of the project. So the reply she gave was that there are three main types of patients: the life-threatening emergency patient, whereby it's a life-threatening issue and those one need to be seen immediately. There's the serious to life-threatening, where it's the second form of patient, and then there's the non-urgent. Those are situations, for example, a headache, a stomach ache. Those are non-urgent patients. And the second question I asked was that when it's advisable to use the internet for self-diagnosis. For example, someone has a headache, so when is it advisable to use the internet to search for tablets and prescriptions that the user or the individual can take. And the advice she gave was that it's never a good idea to use the internet for self-diagnosis. You only use it to check for symptoms that are related to the predicaments the individual is facing. Then the next question I asked was how do you prescribe tablets to individuals with learning disabilities? For example, let's say a user with learning disability wants to use our application, so how is it possible to do that? Well, she said these individuals have carers and support workers that look after them, so they make sure that if the individual with a learning disability has an issue or the other, it monitors that so it could get a tablet or prescription from the hospital. And the final question I asked was, can she give a situation whereby an individual can just carry out self-diagnosis? Well, the answer she gave was, for example, if an illness with just a specific illness and doesn't carry other symptoms, for example, someone has a headache and it doesn't have stomach ache or blurry eye, then you can take Panadol or paracetamol. But if someone has headache followed by itchy eyes, fever, flu, diarrhea, then the person is advisable to see a doctor and not carry out self-diagnosis. In conclusion, I'm going to manage each phase of the user research needs. I'm going to use what we call Moscow methodology. That's a methodology using an agile environment whereby each priority is set in the priorities of must have. Those are the main needs of the project, should have. Those are the second major needs of the project, could have, they could be deliberated on, and won't have, would like to have or won't have. Those are needs of the project that they are not very important. So that's how I'm going to manage each phase of the user research, whereby I'm going to speak with the team each week and each day to know these needs, to know the needs of the project and to deliberate what are not needed. And I also have a sample Gantt chart here to analyze and to describe, illustrate. I'm going to carry each phase and each plan. This is how I plan to carry out the user research. So I need to understand the system. I need to carry out a need analysis and identify similar system, review the need analysis with the team, carry out user analysis, review the user analysis, identify stakeholders, utilize Moscow methodology that I just talked about, that the must have, should have, could have, and would like to have but won't have. And we'll also look at outline the technical requirements and needs, and review the research quality. I also put them into several dates that they must be delivered within. With that, I'd like to conclude it, and the next slide will be my references. Thank you. Well, in conclusion, I'd like to put out some references in case the managers would like to know more about how I got the research facts and how I got some more information about the project. So I've listed down some references. Thank you very much for listening.